Good evening, everyone. It is my pleasure to introduce our esteemed speaker for today's webinar, Dr. Abhineetha Hosthota. Dr. Abhineetha is a professor and head at the Oxford Medical College Hospital and Research Centre, Bangalore. With an impressive academic and clinical career, she has contributed extensively to the field of dermatology with over 30 publications and more than 50 presentations to her credit. She currently serves as the Honorary General Secretary of the Psychodermatology Association of India and is also the convener of the Special Interest Group on Acne and Appendigeal Disorders for 2024 to 2026. Her work has been widely recognized, including receiving the Best Research Work Award for her contributions in conditions such as subcutaneous panniculitis. She has also been honored with the Rising Star Scholarship at both WCD 2019 and ICD 2021. Her areas of expertise include psychodermatology, dermatopathology, and acne, making her uniquely positioned to speak on today's important topic. Today, she will be addressing on the topic common skin changes in aging, hygiene, and personal care, a subject that is highly relevant in promoting healthy aging and improving the quality of life. Please join me in warmly welcoming Dr. Abhineetha, ma'am. Over to you, ma'am.
Good evening, everyone.
Dr. Abhineetha, I think two things are working for you. So you have to close one. Two instruments are working for you. You have to close one of them. Otherwise, what is happening is it is echoing. It is echoing.
Now is it okay, sir?
It is fine, ma. Fine. How are you?
Okay, all good, sir. Thank you. How are you?
We are all, thanks to you, ma, and your medicines. We are all fine.
Yes, sir.
Thank you. So kindly go ahead.
Yes, sir. So this will be this is the second session with all of you. The first session we had it a few months ago in Canada. Now, with the audience expectations, I have improvised a little, I believe. So let's start with the English session. The content will remain the same. It's just that the language would differ for the benefit of the audience. So my topic for today is all about skin aging and how we manage the personal hygiene and maintenance of the aged skin. So first and foremost,
to be very honest, right at the beginning, I tell you, we have been rather demanding that you have to do a session in English because we are benefited by your session in Canada. So we thought that all over across the people should get benefit. That is why we have. See, in fact, your presentation doesn't need any improvisation at all. We are only blessed to see you here and listen to you, ma'am. Kindly go ahead.
Thank you, sir. Thank you for your kind words and encouraging words. So we have another 30 minutes of my talk, another 15 minutes for the interaction with the audience. So today's topic is all about common skin changes, which everybody goes through, if not today, tomorrow. So we know that skin aging cannot be stopped, but it can be dealt in a better way if taken care earlier. So the skin is the largest organ of the body and the most exposed organ of the body as for all of us. And we stay in the tropical climate. So we are exposed closer to the equator. So we are exposed to the harsher sun rays, and it depends on the occupation also. It need not be, the aging will hasten if we have a genetic history and if we have something to do with the occupation, like if we are from the agricultural background or if we are from photo exposed area, that is sun exposure is more from the childhood, then the aging will start quite early. So the aging factors I'll talk to you a little later. So coming to the we divide the changes into appendages. I'll share the PPT for the benefit of the audience. So, 1 second.
Yeah. You go.
Open the screen.
Oh, it is visible?
Yeah, it is, ma. It is.
Okay.
And you can come
So this is
to,
the,
you can increase the size, ma. You can come to presentation mode.
Full screen,
yes.
full screen.
The full screen mode, you can come to presentation mode.
The one Mr. Balakrishna Rao has to mute it.
In fact, yes, I have been muting him. He is again and again. Balakrishna Rao, ಸ್ವಲ್ಪ mute ಮಾಡಿ sir. Yeah, it is now okay, ma.
Now it is fine, sir? Yeah.
Oh, fine, ma, fine.
This is good.
Oh, I'm sorry. Yeah. So this is how the young skin will look. As you see in the picture, it is full of volume. There are no wrinkles, and the hair is black and more expressive. So this is how the younger our cells will look. And as we grow older, there will be a little graying of hair, which is called as wisdom hair, which is well appreciated and carries a lot of value and wisdom. Along with that, we also have little wrinkles on the face, which will talk more about what we have gone through all through our life. So the more the wrinkles, it means to say you have lived your life fulfilling and in a better way. Okay, so that's in a positive note, I would say. And if you have frown lines, you have frowned a little bit. And if you have smile lines, that is around the nose, it means to say you have had a good time of laughter as well in your lifetime. So coming to the common causes of skin aging, it can be because of your metabolic rate, or it can be your family history, a few of the hormones, like as in if the females have undergone hysterectomy, that is uterus got removed little early in time, or if they have any hormonal related diseases, then the skin aging will set in little earlier. And with time, yes, of course, time is one thing which will talk more about the skin aging. UV exposure is both intrinsic and extrinsic. It will damage and intrinsically, that is within the body also, it will be talking about outside the body as well. Apart from that, extrinsic factors include your diet, your lifestyle habits, like your any habits you have, like smoking, alcohol, that will make the skin age faster. Then pollution, it can be air pollution, water pollution, or even now the food is a problem because healthy food has become a rarity now. Everybody is going in for fast food. Even idli dosa has become a fast food partially now. So all that has an impact on the aging skin. It's not that one day you will age overnight. It is a very slow process which you will not realize now. Over a period of time, it will start coming up on the face. So on the microscopic aspect, what you see on the right hand side, the younger skin, you can see there are no marks on the surface. The skin is full. The subcutaneous fat, which is on the lower area, this one.
Yeah, it's fine, ma.
You can, can
Everything
you
is
see
fine.
this pointer?
Yeah, I'm fine. I'm seeing the point.
Yeah. So this is the younger looking younger skin, wherein the skin is clean, clear, there are no spots, and all the tissues are in place with full volume. The collagen here is full. The subcutaneous fat, which gives the volume to the cheeks and the face, is full. As we age, the skin starts shrinking at all levels, and you'll start having the age spot as well. The black marks, what we see on the surface of the skin, is the age spot. And the volume, you can see it has reduced. At the collagen level, there is loss of collagen, and there is the subcutaneous fat, there is loss of subcutaneous tissue as well. So why I'm telling you is that it's not the surface what we see, it's only skin is not just the surface. It talks a lot about your health deep within also. Okay. So this is the fine wrinkles which starts around the eyes. It may be because of the sun exposure, and also if you have eyesight problem where you squeeze the eyes to see or read something, then there will be early wrinkling around the eyes. It starts on the around the eyes, then on the forehead, and there will be dark spots on the cheeks. What you can see here, dark spots on the cheeks, and then there is volume loss. There is the fullness of the cheeks will start sagging, and there'll be wrinkles around the nose and also around the mouth as well. Now, okay. So these are the 8 spots which we call. Generally starts as a brownish patch on the face or on the photo-exposed areas. That is sun-exposed areas more so. It starts as a small, tiny brown dot and slowly increases in size and number. Now, next is this. This is the skin tag, which everybody would be having it or would have had it before. So this is skin colored growth seen on the skin, and it slowly increases in size and number. And here are the cherry hemangiomas. We call it as cherry spots, which is red in color. It is very asymptomatic. I mean, it looks a little scary because it increases in size and number over a period of time, generally seen on the chest and back as we age. The color and size is, it might create panic among the patients, but it is benign. It doesn't cause you any trouble. It is part of the aging process. It's just the collection of blood within the spots. And the last one is seborrheic keratosis, the brown spots, which is also called as age spots. It might, when you have itching or pain in these lesions, you might have to think of getting removed. These are called, if it gets irritated, then it turns red and itching and painful. That time you can get it removed. But otherwise, it doesn't cause trouble to any of the patients. So all these 3 are growths on the skin of different color and different sizes. Either you can leave it just as it is, or you can get it removed at the nearest by the nearest dermatologist closer to your place. Then coming to this, yet another age spot, which is seen mostly on the sun-exposed areas. Here you can see 2 colors. That is, one is a brown and another white spot. White spot, generally people panic thinking that's vitiligo, but every white spot need not be a vitiligo. It can be a aging skin, like how some people have brown spots, some people can have white spots as well. It increases in number, but rarely it increases in size. It may start with a pinpoint and it may go up till 0.5 to 1 centimeter, not beyond that. Here is a major concern for most of the ladies because they develop pigmentation around the cheeks. It's generally because of the cosmetic usage, sun exposure, hormones, hormonal imbalance. If the patients are on any drugs or anything, something related to those topical medicines, like they would have tried fairness creams depending on their occupation or their social requirement, they would have tried. So that would have caused this pigmentary patches on the face. These need not be removed, but there are treatment with creams and sunscreen. It can be dealt in a better way. These are the small black spots which you generally see around the eyes and around the neck. These are asymptomatic. Another cause, it increases in size and slowly increases in number as well. Size may reach up to few millimeters, not even in centimeters. But the only treatment for this would be removal, or if left alone also, it won't cause any concern, major concern, except for aesthetic concern. That is, if you want to feel good, or if it is closer to your eyes, it is blocking your vision, or it is bothering you, then you can get it removed. These are the ones which will not go with creams. This is a skin tag, a solitary skin tag. Sometimes you might get these skin tags in clumps or groups around the neck, around the axilla, that is in the armpit, or you can get it as a solitary, like a single lesion at different places of the body. And the top one, black spot, what you're seeing is nothing but a pigmented nevi. That is what we call it as a birth spot. Some will start from birth and some will start appearing as we grow old. It increases in size and number, but not more than few millimeters. It is also asymptomatic. The major concern among this age group would be, will it turn into a cancer? We Indians we are closer to the equator, we are in the tropical climate. Our skin has a lot of melanocytes, that is the sun protecting factor we have inbuilt in our skin. So generally, none of the skin conditions what I am speaking are going to turn into cancer at any point of time. So these are the few different, all looks the same with little change in the texture and color. But these are the dark mole. The first one, what you're seeing, is the dark mole. And the second one is light colored mole, where the melanocyte, the pigment producing cells are less, then they can have a skin colored mole. These are the skin tags, that is extra growth, which is seen in and around the neck. And this is the wart, which is a viral infection. This also gets acquired through externally. It has to be removed. It doesn't get rid of with the creams or lotions. This again, if it increases in size, this is how it looks. So these are the patches which most of you would have experienced once in your lifetime. As the skin ages, the skin will become thinned out, the volume, there'll be a loss. So the blood vessels which are supplying to the skin are very superficial. A little scratch or little hurt that might bleed within the skin. So that is how these patches will appear. And some of you might be on blood thinners as well for your heart problem or for your any of the internal problem. As a preventive measure, the blood thinners would be given. So those patients, little hurt or an extra scratch would cause these kind of internal bleeding spots, but this will resolve by itself. You need not have to apply any cream or any tablets. Intake is not required. Just left alone, these red spots will turn into brown and then green, then yellow, and slowly fade away. So this is about the skin changes, what I have shared it with you, the common skin changes. You can connect to me at the Oxford Medical College Hospital and Research Center. And I have shared my mobile number and also the mail ID. You can connect to me in any which way. And now coming to I'll stop sharing the screen. Now I'll talk about what is required for the maintenance of the skin. So personal hygiene and personal care practices are very important.
Abhineetha, kindly unmute yourself, ma. Doctor, kindly unmute yourself, ma.
Okay. Okay. So am I audible, sir, now?
Yeah, now you are audible. Yeah.
Yes. So the few up till now I was talking about what are the skin conditions, what we expect during the skin aging. But now I'm talking how we are can be keeping it healthy. So first is using the cleansers. That is soft, mild soap has to be used. And avoid, we all have the habit of using hot water to take bath, but generally it is advised to use lukewarm water, not too hot, not too cold, because hot water you might feel very soothing when you're taking bath, but once you come out of bathing area, the skin will start drying faster. As such, the oil production, the natural oil production in the skin would have reduced over a period of time due to aging. So these will add extra problem to it. So what we have to do is you have to limit your bathing time. That is, keep the bathing time to 5 to 10 minutes maximum. Use mild soap to cleanse yourself and use lukewarm water bath to bathe. And if you feel, you can use a cap of coconut oil to your last mug of water and pour it on the body. So that oily layer will act as a barrier. It will act as a natural moisturizer to your skin. Then dab it dry. The skin has to be dab dried. It should not be vigorously rubbed or vigorously wiped. It has to be dab dried. And when there are few molecules of water left on the surface, even if it is left, it's fine. You can apply an emollient. That is any oil. If you're comfortable with coconut oil, the best and natural way. Olive oil or petroleum, that is liquid petroleum. What we get it as Vaseline can be applied. Glycerin also is advised, but glycerin it makes the skin little dry over a period of time. I would suggest you to use coconut oil or olive oil or liquid paraffin, which is a byproduct of the petrolatum. So these are the emollients which you can use. So what we call it as soak and seal method. First, you have to take bath, and then when there is few molecules, dab it dry. Even when the few molecules of water is left, still you apply the oil or liquid paraffin, whatever is available at your home. And then this oily layer will seal the moisture between the skin and the oil. So the moisture will be locked. That's why we call it as soak and seal method of applying the moisturizer. Once the skin is totally dry and after half an hour you try to apply the moisturizer, it is just a waste of the moisturizer. The quantity is required is more and it may not give you the optimum benefit what is required for the skin. This is the moisturizing part. And then coming to the sun protection. So what do we do and how do we do? We don't, generally you all have the habit of going for a walk. So the sun protection will start from early morning till late evening. As the sun goes, that is from 12 o'clock to 6 o'clock is the harsh sun. The rays are very, very harsh. And now because of the pollution and the ozone layer rupture, a lot of UV rays are entering into the atmosphere. So sun protection is very, very important. You can ask me, like, we need vitamin D also. Vitamin D is required for the skin. Sun is required. So expose yourself to 5 to 10 minutes before 9 o'clock sun. That is more than enough for 5 to 10 minutes. You need not have to sunbathe the entire day for a little bit of vitamin D. Okay. Beyond that, after 9 o'clock, whether you are indoors or outdoors, I would suggest you to apply a sunscreen for the sun exposed areas, especially on the face, neck, upper chest, and also on the hands. Hands, matlab, even the arms. Apart from this, when you're going out in sun, now it is summer, you have to carry an umbrella with you. That has to be light colored umbrella. And because if it is dark color umbrella, it absorbs the heat. The light color will reflect the heat. That is one thing. And also you have to use the sunscreen 30 minutes again, 30 minutes before you step out in the sun. And also you have to use cotton skin, light colored clothes, breathable clothes, cotton clothes preferably for the skin to breathe. And also, you can try wide brimmed hat. That is, the brim should be at least 3 inches broad. All this will protect the skin from aging, and also unnecessary skin-related, sun-related problems. The redness, the itching, the soreness of the skin can be protected if you take care of the sun. This is a bare minimal skincare which you all can follow at your home. Now coming to the nail care. Nails are also, as we age, it becomes dry, brittle, and nail breakage is more. And some people, they can have thickening of the nail also. Thickening of the nail also. So, and people who have the habit of washing the nails frequently will have the habit of washing their nails frequently and working in the kitchen. They have a fungal infection. So when they have brittle nails, they have to visit to the nearest dermatologist to get it checked, whether it is the infection or it is because of the nutritional deficiency or it is simply the part of the aging nail. Here, it is about hair care.
See your face, doctor. We are unable to see your face.
Oh, you're not able to see my face?
Yeah, doctor, I mean, what is happening is that this thing is muted. Your photo is muted. I'm also trying to, focus it. It's not happening.
Video is on.
Video is on. Now you are seen, ma.
Okay.
Now you are, yeah. Now you are, yeah. Now you are.
So we can see the beautiful face.
Oh. Yeah. Thank you, ma'am. So I hope I was audible all this while.
No, you are very much audible.
Okay.
Problem was only with regard to your video. See,
Okay.
it was just going and coming like that. It was happening.
Okay.
And there is some also. See, is there any background noise there? If your system or something like that.
Yes, sir. I'm still in the hospital, so there is
okay.
background.
I understand.
Okay.
No problem.
So last few sentences I've left with. One is a nail care, which I have told you. And for nail also, you can use Vaseline petroleum jelly to keep it soft and moisturized. And if you are into wet work like gardening or kitchen work, try to avoid frequent washing of your hands. And once washed, you have to apply a moisturizer for the whole hand, including the nails. And regular trimming of the nails is important, not to over trim it, because if you over trim it, the nail tries to come in a haphazard way that it will start curling up and you will have more problem. So trim it as and when is required. Over trimming is not advised. And coming to the hair care. So, gray hair is actually a good thing to have because it carries a lot of wisdom. And I would always suggest not to go for hair dyes. Yeah, I have heard that once you start using the hair dye and it tends to, it becomes a vicious cycle, you cannot get rid of it. But if given a choice, I would always prefer and suggest everyone to go gray because it's a natural process, not to curtail it, not to go against the nature, because all the hair dyes, no matter what they say, what they claim, it does contain harsh chemicals. It makes the hair fragile. It makes the hair dry. It might look black, but it may not look healthy. So that is one thing. And use gentle shampoos. Even shikakai is fine, but use gently. Once a week, shampooing is more than enough. Everyday scalp moisturizing is important with your coconut oil or castor oil, whatever comforts you, that has to be used for the hair as well. Hair, matlab, the scalp, I would say, which the hair also will absorb over a time. And coming to the most important thing is the itching part and also the dry skin. That is mostly because of the frequent usage of soap, dehydration, and if the environment is dry and not humid, these are the conditions where we get dry skin. And because of the dry skin, you will get itching. So, as I told you, the bathing rules, the same thing will apply here also. You have to keep yourself hydrated in terms of water intake or through juices. It's up to you how you want to take care. Foot care is through a daily inspection, because that you would have been educated by the dietitian also about how to take care of your foot, because any small wound in the foot can become a big issue later in case if you're diabetic. So daily you have to inspect the foot. If there is a wound, if there is any nail growth, extra growth, that has to be trimmed. Soft, comfortable footwear has to be used while you're inside the house or you're going for walking. That will protect your unnecessary trauma to your feet. And if there are any fissures, that is fissure feet, that feet is at the high forefoot or hind foot has any breakages, that has to be taken care with applying a lot of moisturizer, and soak your feet in warm water, cleanse it, and apply Vaseline petroleum jelly, and wear socks for at least 1 hour in a day. That will keep the skin of the feet soft and supple, prevents unnecessary breakages. And if you have any immobile patients at home or your society or in your society, that they have to be advised to use cushions, especially water-based, and mattresses also water-based or air-based, to prevent the pressure ulcers. Lifestyle measures, this will be my last few sentences before winding up. So the lifestyle measures is adequate hydration is very, very important, and good sleep hygiene. That is, sleep at the right time. Whether you get sleep or not, you have to hit the bed at the right time. Try to have at least 5 to 6 hours of sleep. I know sleep is a major issue as we grow old. That is one thing. Have a balanced diet, which has to have proteins, carbohydrates, and vitamins as well. Regular physical activity, whatever is feasible for your age and your body cooperation, as per your body cooperation. Avoid smoking and alcohol as much as possible. So these are the few key points which I would want you to, keep in mind. Dry skin is a major complaint and the most common complaint of all the elderly. And there should be collagen loss. There'll be a collagen loss. There'll be reduction in hydration. Everybody, if not today, everybody will go through the aging. We are not Yayati who has conquered aging, but we all go through aging. So if you have not taken care till now, but today you can start it and make a change in future as well. Good skincare will definitely improve your quality of life, because skin is the index of the mirror and also the index of your internal health. Good shiny skin will suggest that you are healthy within, mentally and physically. And if you feel anything in doubt, any skin growth is causing you itching or pain, rapid increase in size, or if there is any bleeding from those skin growths, kindly visit a nearest dermatologist for further management. So this will end my talk. Thank you all the audience for your patient listening, and also thanks to NIMHANS for giving me an opportunity to be a part of this event. So I'm open for any questions from the audience side.
Yeah. Thank you, Doctor. See, before I am opening the session to all the audience, before that, I just like to thank you. And in fact, I want to tell all our audience that how important parts you have played in shaping our question and answers for these kind of webinars, rating of the webinars, etc., by being a member of the empowered group, enhanced group, etc., and your contribution to that. In fact, that needs to be recognized, number one. Number two, before we get into that, Doctor, I like to know what are all the types of skin. See, you talked about dry skin. Are there any other types of skins available? And how, or what are they? I mean, what are the basic characteristics of this skin, Doctor?
So the skin type will start with, that is all told when we are in the younger age group. where we can have oily skin, we can have dry skin, we can have mixture of skin. But as we age, everybody will fall into the same boat. Everybody's skin will thin, everybody's skin will go dry, if not today, tomorrow. So there is only one skin type. After we cross 50, it is dry skin.
It is only dry skin. Therefore,
Yeah.
there is no going back to the oily skin or
No,
something
no,
like that.
no.
So everybody will like the graying of hair.
Yes.
I think Jayalakshmi should be very happy about that, because you have said that graying of hair is a very, very good index. Therefore,
Yes.
she should be happy about it. In fact, I am also happy about it. It is not as if that she is alone having that. So, doctor, my second question will be: see, you are talking about the sunscreens. What are all these sunscreens? See, because there are so many sunscreens in the market today. Which one sunscreen is the best? And or I mean, is there any specific number you would say that SPF number so and so, so and so, so and so? That will be very useful, doctor.
Yeah, the thing is, sunscreen for Indian skin. We, by God's grace, we all have good skin, and we already have pigment producing cells within the skin, which will protect our skin naturally. But still, considering the pollution and the amount of harmful rays entering the environment, we need to take care of our skin. So the best and foremost, and the easily available is calamine lotion, which can be used as a sunscreen. Okay. And medicated sunscreen, you need to visit a dermatologist, because it depends on your skin, how old it is, and what is the requirement, depending on your occupation and your sun exposure amount. Depending on that, we have to suggest a sunscreen. So if in general, if you ask me, calamine lotion can be used for all age group, for all skin types.
Thank you, doctor.
Liquid carabin, liquid
So one second, sir. Ganesh, one second. See, in fact, you will not say that 30, 40 something. These numbers, etc., are all coming for this sunscreen. Would you suggest any particular number, doctor?
Yeah. SPF, anything above 15 is good for Indian skin. It doesn't mean that higher the SPF, higher the protection. It depends on how much you apply, how frequently you apply, and what type you apply. So if you are going into a physical activity, if you are going to sweat, then you have to apply it more frequently. Otherwise, you have to apply every 4 hours once to all the sun exposed areas. Anything above 15 is good. Sufficient.
After you
1.5,
50.
1.5. Okay. Sir, Ganesh, sir, before you raise
Yeah,
the question.
I have 2-3 questions.
Okay.
How about using liquid paraffin?
Yeah, liquid paraffin is a moisturizer. It's very good. It is a byproduct. I would still suggest going for coconut oil or olive oil to apply. If you are comfortable, liquid paraffin is also good enough. Like that is also the method of application matters. Soon after you take, I told you, soak and seal method. That is, you soak your body after bath, dab it dry, apply the liquid paraffin good amount, so that the liquid paraffin, the oily layer, and the skin will act as a sandwich, and it will protect the moisture, the hydration of the skin.
Thank you very much.
Liquid paraffin.
Regarding the oil bath, we were having an Indian tradition that we used to have an oil bath. Can you throw some light on it? There is a lot of debate on that, actually.
Yeah, oil bath is advised. Oil bath massage, I still have my own doubts. I would not suggest. But oil bath is once a week is always advisable. And you have to be careful of the bathroom as well. If they have anti-skid, then it's preferred. Otherwise, as we age, the falls are more frequent and bones are very brittle, so you have to be careful. So the basic or the bare minimum what I would suggest is to apply to use 1 cap of coconut oil to the last tub of your bathing, and then put it on the body and dab it dry and apply your moisturizer, whatever, liquid paraffin or a coconut oil, whatever
it's
it
a
is.
good idea actually.
Yeah.
In the mug you can have a small mixture.
Correct.
And last mug you can try
Yes.
so that it will get.
It will
Then my last question is about eye bags. Below the eyes you get the eye bag. And what is the reason, and is there any method so that you can delay it or?
Yeah, eye bags generally it depends because of the volume loss. The skin around the eyes are very loose, and that is how you get it. May be fluid collection, or it may be fat herniation. So as we age, generally we cannot reduce this with just with the creams or soaps. We say fillers, so it is difficult. Naturally, how we can reduce is keeping hydration, using a pillow, and also you can
Nice
use
sleep may
sleep
help.
is very good. Sleep is very good. That keeps your whole body healthy, skin,
What
mind, and
Doctor is very good.
Thank you.
You said
Thank
something.
you, ma'am.
One second, ma'am. Where is madam? 1 second. Mala, ma'am. Madam.
Yes, sir.
Please, your question, ma'am. Please,
No,
but why you
Hello,
are-
doctor.
Yeah, yeah.
Hello.
something is very good. I want to know that very good.
1 second, ma'am. 1 second.
You answered for her. You
Yeah,
answered
madam.
gentleman. What you answered, you said that is very good. I want to
Madam.
use it properly.
Jayalakshmi madam, 1 second. Let the Malam finish it, then you can.
Allah, அது மறந்து போயிடும் sir. That subject will go away.
No, you are so great in remembering things, ma'am.
No, he was telling, she was telling something to him, and she said that is very good. I wanted to know what is very good because I did not hear properly.
No, which one second, 1 second.
Sleep, madam, it was sleep.
Sleep.
Yeah.
Oh, yeah. Now she is satisfied. Yeah.
You are satisfied. Yeah. Oh, okay. Madam, Mala, madam, you can just raise.
Okay.
Yeah.
Not
May I
giving me
say
a
now?
chance.
You will get it, sir. You will get it, sir. So go ahead.
Okay. Thank you, doctor, for a very good presentation. This dealing with skin is a very vast subject, and you tried your maximum best to cover it in within an hour. So I just would like to know, as we age, does our skin become dark?
No, generally skin doesn't become dark with age. That the color will remain the same, but it might turn dark because of the hair dye usage, or if you are using any turmeric, because not all the turmeric are natural. Okay, they are color mixed, so that could be one. And if you are using any fragrance in any form, it can be perfume, or it can be cosmetics, it can be any which way the fragrance will cause. And if you have any, if you are a vegetarian and if there is any nutritional deficiency, then the skin slowly turns dark. And when you go out on a sunny day, that also it becomes dark. But that sun related darkness, it will fade away. If you are inside the house, it will fade away in few weeks. But if the skin darkening is persisting, then you have to check yourself whether there is any nutritional deficiency, or there is any hormonal imbalance like thyroid hormone or diabetes, or any female related hormones there is imbalance. Then you have to get it checked.
Some kind of dark patches has appeared in one of my friends. This thing. So of course she has tried a lot of treatment, but it's even the steroids, as normally you would recommend for a brief period, but it's not giving much of result. So that's why that called dark kind of pigmentation and dark patches. So there could be some deeper, the diagnosis assessment, further assessment is required. And so one more thing, doctor, this you said that applying this hair dye is not good. How about this, what they call this organic hair dye, and does it help? Because
apart from the patta mehendi is the green leaves. Green leaf, you pluck it from the plant and grind it and apply it, then only it is natural. Anything packed is always chemical.
Okay, and the skin, the psychologists, they say skin is our second mind. So any kind of stress and other things that I think that will also have a bearing on our skin.
Yeah, if not today, it is a slow aging process. It has an impact. Skin is the index of internal health.
Doctor,
Thank you.
can I
Thank
go?
you.
Yeah, thank you. And Jayalakshmi ma'am, you can ask. You can ask. It is your turn.
To know, any cooking oil will make our skin different, doctor? Cooking oil. We use many things, ginger oil, groundnut oil, coconut oil for cooking. Whether it has any deficiency in our body for the skin change?
No, the deficiency, we generally say if you are a vegetarian to take flax seeds, omega-3 fatty acids are generally advised. That is through flax seeds, chia seeds, sabza seeds. They all have antioxidants that acts as at the cellular level, it prevents the aging. Not just the skin is aging, at cells at all levels is aging. It may be cells of the kidney, cells of the liver, cells of the heart, everything will age over a period of time. To prevent, if we cannot prevent, we can delay the aging by these seeds, usage of seeds. If it's a non-vegetarian, if they have a lot of fish oil, then that would help them.
How about using ghee, doctor? Ghee.
Ghee, eating is good. Ghee, if you ask me, it is always better than butter. Application, I don't think so. It has any greater impact, but consumption, it definitely has an impact.
That's what I want to know. Whether I can use ghee even in this age. Even in this age. No problem.
Yeah. No problem. You are not eating, you are not having ghee in liters. You are having 1 or 2 teaspoons. That is always healthy. Anything had in moderation, it's always healthy.
So, Nehru sir.
Good evening, Doctor. Thank you for your focused presentation. Just I have a simple question.
Yes.
Usually, aged people, keep on taking several medicines, etc. Can you say something about the medicine related allergies on the skin?
Yeah, medicine related allergy, any drugs when you taken it, if it is medicine related, it will start within 24 to 48 hours. It can generally they'll have just a minute, hold on.
Oh, holding. Oh, no problem.
I'm sorry. So this drug related, it generally anti-diabetic drugs will be there, lipid lowering agents, that is cholesterol drugs will be there, or antihypertensive. So any of these drugs, if you develop any itching or rashes, it generally develops within 24 to 48 hours. If not, then it may not be related to drugs. And until and unless you take it, we cannot tell which your body is allergic to which drug. Not everybody will develop drug allergy. So hope I have answered your concerns.
Okay.
What about the fungus-like growth on the skin? Fungus
Infection. Yeah, fungal infection generally happens because of the weather, that is sultry summer weather, a lot of sweating, and poor hygiene and uncontrolled diabetes, using tight fitting clothes. And when you take bath, if the private area is not washed or it not dried properly, sitting long hours and try to take bath after you finish your walk. These are the few things which can lead to fungal growth. Anywhere there is moisture, definitely there will be fungus. It can be on the body or it can be in the kitchen also. It can be on the house walls also. So try to take care of the moisture part of it. It should not be wet and damp in those private areas. That's when the fungus grows. Once it grows, it has to be dealt with tablets and creams that can be done after visiting to a dermatologist.
Now, Padma madam, you wanted to raise some question? Unmute.
Yeah, I would like to ask. Hello.
Tell me, ma.
Yeah, I want to know about the nails, especially the feet nails. as you age, they become very thick, and you have a tendency that you have ingrowing nails. How do you manage that?
Yeah, the skin, as we age, either it becomes brittle or it becomes thick. So why we have ingrown nails is because of the frequent trimming of the nails.
Frequent?
Trimming of the nails.
Okay.
Excessive trimming. So
Okay.
that's why the nail, instead of growing straight, it tends to curve and grow. The curved part of the nail will start pinching your soft tissue below it. The tissue below it, the skin below the nail will start getting hurt. That's why the one is ill-fitting footwear. That is, the footwear should have a breathing space. It should not be too tight or too loose. And the footwear has to be washed and kept clean frequently. And you can have coexisting fungal infection of the nail as well, and over trimming of the nails. These are the few things which would affect the nail health.
But if the nail overgrows also, it may give you problem, no? Because they kind of poke you and you get hurt.
Yeah, but at a certain distance, it should grow away from the skin. Then only you have to trim it. You cannot trim it very frequently.
Otherwise.
Because compared to fingernails, the toenails will take a little longer. They are slow in growth. What we do is, when we sit for trimming, we trim hand and toenails together. Fingernails and
Okay.
toenails together. That is not required. If you trim your fingernails weekly once, the trimming for the feet nails will recur once a month. That's more than enough.
But what about pedicure and manicure? Should it be done periodically?
I would suggest you to do it at home itself, not to use any parlor services, because that is a common thing.
Can you be a little louder, ma'am?
Which is generally they use the common instruments. If it is not hygienic, then there are chances of you catching infection or catching more trouble. So I would suggest you to do pedicure, manicure at home itself with your own instruments.
And what about the fungal infection? Can we treat ourselves with just antifungal course once a year or something like that without the prescription?
Fungal infection, it depends on the occupation, the contact with the water, diabetic status, and your overall health as well. Fungal infection cannot be self-treated. You have to visit to a dermatologist to start off the medicines. They will advise you the course that has to be followed religiously. If it is fingernail fungus, it requires at least 6 weeks to 6 months. Whereas if it is toenail fungus, it requires 12 weeks to 12 months of treatment.
What about the steroids that they give? Normally, the doctors prescribe steroid ointment.
Not all the infections or not all the skin condition requires steroids. Until and unless we see, it's difficult to say what is advisable.
But is it okay if you use steroid creams and?
No. Steroids is not the drug of choice for skin for a longer duration of time. Even if the dermatologist would prescribe, they will prescribe only for a week to 10 days, not more than that. So self-medication is always harmful.
Okay, thank you so much.
Yeah. But you have to depend on your doctor, ma. You cannot raise, doubts about the doctor's treatment methodology, etc., etc. The doctors, we have to rely on them, and we'll have to go ahead with that.
Yeah, that is true.
Last question from my side. Doctor, the last question. I sweat a lot. My hair and also becomes so this one. Water drips from the head even during night. Can we avoid that one, doctor?
That we have to take care of. If you're what is the age group also matters. If you're in the menopause or perimenopausal time, then it happens.
I'm 77 years old.
Okay. And if you have thyroid, then it happens. And if there is sudden drop in your blood sugar levels, then it sweats.
Too much pillow, everything becomes so wet.
No, that's
Yeah.
Jayalakshmi madam, only one thing. What doctors is suggesting is that, see, you rule out all these things. That is, you find out your, the blood sugar level. Does it drop suddenly? You note down that. You see, these are all certain tips she is giving. Therefore, a regular consultation here may not be very good, no? So what I suggest is that you can always talk to her,
No,
and take a treatment.
no, everything is normal. That's why I am asking her. Everything is normal, but even then I sweat. That's why I am asking her what is the reason.
No, I agree, ma'am. What all I'm saying is that once we are going into a personal this thing, medication, etc., personal problems, then it will be difficult for a doctor to suggest this or in a meeting like this. Therefore, she needs to check so many other parameters. Therefore, let us not put the doctor into some kind of a, situation. So that we will just keep it like this. So she says that these are all the conditions that could help you, that could help you in that. Therefore, try this or go to her. She will be able to suggest. So she is only in Bangalore. You can always visit her. She will be able to suggest. Okay, you are muted. You are muted.
Ma'am, I have one question, like about the
Yeah,
hair
please,
loss.
please,
Like
please.
start losing on the forehead sometimes. What are the reasons, and do we have any medicine or drops to protect it?
Yeah, for the hair loss, generally, as we age, there'll be graying, thinning of the hair. The number of hair follicles will reduce. It also depends on your hairstyle, if you're applying hair dye, and your nutritional status, if it is not well maintained, and if you have any thyroid, diabetes, or hypertension, and a family history of thinning of hair. So these are the few areas, the few causes which can be the reason for your hair loss, for which over-the-counter drugs I would not suggest. It's better you visit a dermatologist, get yourself evaluated, any nutritional deficiency internally, then as per that you start the treatment.
Okay. Any other question, ma'am? See, the doctor is also a busy doctor, and she has to travel back all the way to Bangalore. She says still she is in the hospital. Yeah. Any other question? Otherwise, we can request. We can request for the closure of the meeting if doctor is comfortable. Hello. One second. Stacy?
Yes, sir.
I think you can close down.
Okay. Thank you, ma'am, for this wonderful session. It was very interactive. A lot of our participants had a lot of questions and queries, and you had pointed out, everyday tips that people can take away into their daily lives. So thank you for that informative session, ma'am. And hopefully we get to meet you in more sessions coming forth.
Definitely. You let me know the feedback from the audience. We'll take up the next topic as per their requirement.
Yeah, that will be very nice of you, doctor. See, in fact, we are unnecessarily taxing you. We know that, but it's okay. It's always better to meet and talk. See, this is a very good forum where we are definitely benefited. I'd say, look at the kind of appreciations that have come up in this thing. Almost everyone has appreciated this session. So it was a very wonderful session. Thank you for that. May God bless you, ma. Thank you.
Thank you very much.